When emergency first responders were overwhelmed by Los Angeles County's most destructive fire yet, a band of surfers, along with their neighbors and friends, stepped up to defend their home turf in Malibu. Their devotion to home drove them to show up for their community during the fire and for years afterward. And now, a model they call the Community Brigade program could change everything, leading to more lives and more homes saved during the increasing wildfires across not just California, but the world. Join reporter Adriana Cargill from KCRW, NPR's All Things Considered, Crooked Media, and more, as she investigates a wildfire story that is not depressing, but is, in fact, a clear hope for the future. Listen now to Sandcastles, an award-winning podcast about home, how we create it, and why we fight so hard for it. Welcome to Important, Not Important. My name is Quinn Emmett.
And I'm Brian Colbert Kennedy.
And this is Science for People Who Give a Shit.
That's right. We give you the tools that you need to fight for a better future for everyone. The context, straight from the smartest people on planet Earth, and the action steps that you can take to support them.
That's right. Our guests are scientists, data engineers, doctors, nurses, journalists, other engineers. There's got to be so many kinds of engineers at this point. Farmers, politicians, activists, educators, CEOs, astronauts, even a reverend.
Wow. Hey, this is your friendly reminder, by the way, that you can send questions, thoughts, and feedback to us on Twitter at ImportantNotImp, or email us at questions@importantnotimportant.com. You can also join tens of thousands of other smart people and subscribe to our free weekly newsletter at importantnotimportant.com.
That's right. And if any of you work at Twitter and you just want to give us a few more characters, sure, it'd be great to have the whole name out there someday. Should I have picked a shorter name at the beginning? Probably. Brian, this week's episode, oh man, what a conversation. We are talking about the new endeavor. What a project. What a spreadsheet. Global.Health. It is the new standard in COVID data. And really what we're asking is, what have we learned and where does epidemiology go from here?
That's right. And our guests, the mad engineer behind the whole thing, Mr. Robel Casa, and then returning for his second appearance, for some reason, like Quinn always likes to say, Dr. Sam Scarpino.
Unclear. Yeah, man.
Yeah, pretty amazing. They've built this thing alongside Google, the Rockefeller Foundation, Oxford, Harvard, Northeastern, Boston Children's Hospital, Georgetown, Johns Hopkins, and more.
The list seems endless, but Brian, is it enough?
Yeah.
Serious question. And why not? I think we should go find out.
Let's do it.
Awesome. Here we go. Our guests today are Dr. Sam Scarpino, coming back for some reason, and Robel Casa. And together we're going to talk about the future of data and medicine, because the tail end of a catastrophic pandemic is a good as time as any to start building for the future. Sam and Robel, welcome.
Glad to be here. Thanks for having me back.
For sure.
Thank you. Thanks for having me.
Absolutely.
Yes, it's awesome to have you back and awesome to have you, Robel. Sam and Robel, give us a quick little, reminder for you, Sam, the audience, sort of who you are and what you do, and then Robel, same thing.
Yeah, great. So Sam Scarpino, I'm an assistant professor at Northeastern University in Boston. Primarily what we do is build mathematical and computer simulation models of infectious disease outbreaks. And then we take things that we learn from those models and try to use them to improve public health and clinical decision making. And so, as you might imagine, we spend a lot of time working with data, trying to inform our models with data, trying to improve data systems, which is how I came to know Robel and how we got involved in this project that I suspect we'll talk more about over the course of our conversation.
Awesome.
Awesome.
Robel, what's your story, man? Who are you?
I am Robel. So I'm a software engineer based out of Washington, D.C. Do a lot of front-end development. The past few years have been focused on products around data collection for healthcare, public health type of programs. And that's how I met Sam about 5 years ago now, working on a product. Currently, I work with Northeastern to support Sam and his team with some data visualization stuff, while also continuing to work on a separate product.
Awesome. Rock and roll.
Very cool. Quick reminder for everyone listening, and you guys, of course, our goal on the show always is to provide some context for quick context for our topic today, or our question of the day, and then we'll dig into some action-oriented questions and what everyone out there can do to help support you guys. Sound good?
Sounds good.
Yeah, sounds great.
Rock on. Okay, so should have dug up Sam's original answer to this question, and we'll find it somewhere.
Oh yeah.
But Sam, to remind you and Rebel, we do like to start with one question to set the tone for this fiasco. Instead of saying, tell us your entire life story, as interesting as I'm sure that is, we like to ask, why are you vital to the survival of the species? And Rebel, just because you made that face, we're going to start with you. I encourage you to be bold and honest. You are here for a reason.
A really good answer always comes out, even though it sounds wild at first.
I think there's a chance I forgot to warn Robel about this.
Oh, that's very convenient.
There might be a chance. Yeah. Why am I vital to me? I am not. I don't think I am. I don't think any one of us as individuals are. I think the collective is probably more vital to survive than any particular individual could be. But yeah, I think I'm comfortable with that answer.
It's going to be really awkward when Sam goes on a 5-minute tirade about
Yeah.
how important he is. Let's hear it, Dr. Scarpino.
Well, I am thinking, that is almost exactly what I said the last time we spoke. I completely agree with Robel that no one individual is vital. It's how we work together, the systems that we build, the collaborations we build, how we support each other. I think the one thing I would add to that, and it's the number one reason why I'm an academic, is working with students, training the next generation of scholars, and working with undergraduates who will go on to a variety of different careers, hopefully helping them think more clearly and critically about data. And I'm one of a huge number of people that do this, so also not vital in that area, but it certainly feels like one of the more important things I do day in and day out is teach and mentor.
That seems like a pretty reasonable answer.
Yes, that's super, super vital.
Pass it on.
I was significantly more eloquent than
Yeah, but he's had 2 tries at it. We'll call you in 2 years after the next pandemic, and we'll do it again.
Oh God! Oh no!
So I just want to set a little. Thank you for that, gentlemen. We set a little context usually for this thing, so everybody gets on the same page. Our discussions, we've done 110 of these now, can be very scientific. They can be ethical. They can be a mix. They can cover a lot of stuff. We talk about some fairly complex stuff on this show, right? And trying to understand them requires committing oneself to a generalist's education on a huge variety of things. This potpourri of systemic thinking and first principles thinking, and some sociology and biology and history and pedology and ecology and activism, right? And political science, and maybe some religion and atmospheric science and empathy and ethics and data science. And that's not to say that an advanced degree is required in any one of these areas of study, but we've got plenty of listeners who have multiples of those. But to try and understand, to try and process these things and act on the things that are happening now and what's coming requires a concerted effort for all of us, I think, to rethink how to think. And we talk a lot more than ever lately, especially that the past cannot predict the future, whether we're talking about climate change or infectious disease or antibiotics, right? SARS-CoV-1 did not fully predict SARS-CoV-2. And Hurricane Andrew is not the same as Hurricane Harvey, which was longer and wetter. And so the world is changing quickly. And thankfully there are, right? There's these mental models and philosophies we can adopt to help frame how to think and our actions. And there are experts in all these fields working, as we like to say, on the front lines of the future, who can teach us the specifics, to give us the bit we need to understand the macros, right? And so we seek those people out, and everybody seeks those people out when they're scared. We want to look for someone like Sam, who's been studying the epidemiological side of this, right? Their whole life, who know it, who've seen it coming, who quote unquote have been training their whole life for this moment, right? Who might be able to say, as you were saying, Sam, offline, when you called into the sports shows, you might have an idea where this thing is going, right? And in, a year ago, February, more than a year ago, March 2020, there weren't a whole lot of publicly available or at least readable, digestible models for how a novel coronavirus like this might sweep its way through a population of a planet where everyone is susceptible. But not long after, right? I saw this joke on Twitter. Everyone's going to look up in 5 years and try to figure out why they're following 6 epidemiologists on Twitter after they've blacked it all out. But at that, a few months in, everybody, your friends, your family, your bosses, everybody had their favorite model they were looking at, right? The federal government had a model, state governments had them, universities had them, teenagers who just knew the bare bones like SQL had models. But we face down these relatively slower moving threats like climate change every day, right? We know what hurricanes can do, and we have a pretty good idea how they're changing, and wildfires and how they're changing. And we know what assault rifles can do, and we know what urban heat is doing. So we're pretty familiar with the inputs and the outputs on these things, from a natural science level to society to individual. But despite years of warnings of how something like COVID and SARS-CoV-2 would happen, we didn't know how it was going to go, right? We didn't know how people would react. We didn't understand the inputs fully, right? And whether you had talk about on a federal leadership level or individually, we didn't know how it was going to affect us in the biological sense, how governments and workplaces would react. And so a lot of those models really didn't agree. And that was fucking terrifying for a lot of people. And so what I want to get into is, what do we still have to learn? And how can we do better going forward? And so, guys, if you could, after all that, I'd love for you to talk about Global.Health. What is it? Why does it matter? And how is it different from everything we've all been looking at this past year?
Wow. Well, there's a lot to unpack there.
For sure.
I think I could probably teach and would very much enjoy an entire course just trying to understand the nuances of, or the implications of some of the things you said. Interestingly enough, at least where I saw that quote about why are we following all these epidemiologists, it was something that Nate Silver said. Right. And I promptly quote retweeted him and said, I can't wait until I'm wondering why I'm following all these pollsters after the election's over.
100%.
But,
right.
To your point, and I'll be brief at this stage because I'm very curious to hear from Robel his perspective. But and I may go back and modify this in a minute. But the human response to pandemics, or the human response to an infectious disease outbreak, is typically what determines whether it becomes a pandemic. So whether we do a good job like they did in Vietnam, Thailand, Mongolia, New Zealand, Nigeria, or a bad job like the United States, UK, that really dictates a lot of what's going to end up happening. And so I think a big part of the reason why COVID-19 became a pandemic was precisely because it broke so many of our mental models about how to respond to an infectious disease outbreak, at least in the US and Western Europe. And I actually think that's the kind of thing that we need to be prepared for, is that the next pandemic is not going to look like COVID because we'll be ready for a COVID. It's going to look like something else. And that's actually, from a technology side, one of the things that Robel and I have been working on for years now, is how we build data systems, data visualization systems that anticipate the need for not knowing what the hell we're doing as it's happening. And that's what we're trying to do at Global.Health. We can say a little bit more about specifically what we have done, but the ultimate goal is to engineer something that's going to be ready for whatever it is we're not going to be able to predict in a year from now or in 5 years.
So the question that stuck with me, what is the thing that we're going to learn that is going to help us with the next one, right? Mm-hmm. Essentially, I'm not quoting you verbatim.
No, please.
I am not an epidemiologist by trade. I build things for mobile devices and the internet, and that's what I do. But the one thing, my takeaway from all this has been that obviously the models are going to change. The next pandemic or epidemic is going to be different, but I hope that we rethink how we think, and it sort of goes back to how you mentioned empathy, and a lot of the past year I feel has been mired in figuring out how to think about the pandemic, how to think about human behavior, how to think about what to do to mitigate the spread. And the data models help, but like how people treat evidence, how people behave around evidence, how people react to it, I think has been more telling than what any of the data models could possibly tell us. COVID is significantly different from SARS and significantly different from the Spanish flu. But the one thing that has been consistent through it all is that human beings have behaved certain ways through it and have lived through it. So to be stubborn about what we choose to believe and learn from these things is I think what could be either meaningful and helpful for the next one, or absolutely detrimental.
So we need to fix people then. That's what it sounds like. Fix all
as a non-epidemiologist, that would be my take. That is the one thing that I've learned from the past year, is that there is something that is inherently broken about people that sort of gets in the way of us being able to get past this. Because whether it's me and you and us as regular citizens or people who dictate policy and governance, I feel that this could have been fixed in 3 to 6 months. Just don't be an asshole. Don't do dumb shit. Don't be selfish. Stay your ass at home. The government's going to take care of critical workers and employees and make sure everybody's taken care of. We're going to get over this hump in 3 to 6 months. Done.
We should have a separate conversation about this topic. It would be incredible. Seriously, would love it.
I think I may have derailed this whole entire show.
No. We're going to get it back on. Yeah.
It's typically how this goes. But go ahead, Sam.
I was going to say very quickly, what we're going to find out is that Robel is running for the United States Senate, and he's going to be announcing his candidacy shortly.
Yes. Yes.
No, but to actually kind of take what Robel was saying and tie it back to Global.Health, I gave a presentation this morning about the work that we're doing. So one of the things we've done is to curate a database of 25 million COVID-19 records at the individual level that have been anonymized from 160 countries. Stephen Johnson, writing for the New York Times Magazine, said it may well be the most complete portrait of this virus in existence on the planet. And so one thought might be, if we're going to learn anything about this, it might help to have a data set that's representative of the global picture of COVID. And I think there's some truth to that. But I'm also, as in your intro, Quinn, I'm skeptical about how much we're going to be able to generalize going forward. And so what am I getting at here? Well, one of the questions that came up in the Q&A is, are you building AI models to predict when we're going to get to herd immunity threshold in different states in the US? And my response was, we don't need AI models for that. I'll tell you what the problem is. Only individuals over 18 are eligible for the vaccine. We need to vaccinate 75 to 85% of the entire US population to get to herd immunity threshold. So that basically means we've got to vaccinate every single person over the age of 18 until they lower the age group. So the question is not about the logistics of the rollout, the lack of equity. All those things are true. There's grossly unequal, not even equity. It's grossly unequal in terms of race, ethnicity, socioeconomics. But the big issues, vaccine hesitancy, anti-vax, these things that have been around literally since the first time a vaccine went in somebody's arm are the same battles that we're fighting now. And so that's also part of what we're trying to do at Global.Health, is to understand that this is not a problem that can be solved by one expert or a handful of experts, that you have to bring together a large, diverse, and representative group of people who are committed to two things. One, trying to get out of this quickly and prevent it from happening again. And two, not being assholes. And that's basically the goal of Global.Health. And we're fortunate to have technologists like Rebel who are helping us build the kinds of data systems that will scale as we grow from 25 million records to 50 or 100 million records, but then as we respond to the next infectious disease outbreak, and also help us communicate what do we know about COVID from 25 million records. Well, that means we've got to build intuitive, interactive data visualization systems that tell the story accurately and in a transparent way so that people can perform their own audits around whether they believe what we're communicating or not. And so all of these things are really wrapped up into this large, complex system that we're trying to work on. And that means we're not going to be able to pick apart little pieces. We're not going to be able to reduce it down into a set of separate problems. We have to come at the whole in unison. And that means we've got to have a big collaborative group all working together towards this common objective.
And it seems like that's what you guys have put together. I mean, the list of folks and institutions involved is, I don't want to say comprehensive, but it seems like a bit of the Avengers of folks who've been working on this so diligently for the past year to, like you said, try to build something that tells as much of the story as we can tell.
Well, I can tell you, I think that's true to a certain extent, although we are overwhelmingly represented by individuals that are based in the United States and the UK. We do have people who work in countries in South America, who work in China. We have some collaborators in South Africa, but there are large swaths of humanity that are not at all represented in our consortium. And that's one of the things we're working actively to try and address, is how we build better global representation, because we can't solve the problem without it.
And what about so I believe, and correct me if I'm wrong, you're talking about the folks that are involved on constructing this thing. What about the data, the records you have so far? Obviously they're anonymized, but can you talk at all a little bit about where they're pulled from? Like, is Brazil's nightmare situation involved? Is so much of West Africa, which is doing seemingly very, relatively much better? Like, I guess, how are those records being included, if at all?
Yeah, so we have data from about 160 countries. And only recently did we have more data coming from the US and Western Europe than the rest of the world. And that's because the US had to release all of their individual level anonymized records as a result of open records request, I think, from the New York Times. So we got about 16 million cases from the United States, which doubled our data set size.
Did you get 16 million faxes? Is that how you got it?
It's very nearly that, yes. At some point over beers, I'll tell you about how we tried to dump 16 million records into the database, and about an hour before we launched, and Rebel was sitting there very calmly and coolly deleting them as I was trying to dump them in there with the rest of the data team.
That's an entire.
But I don't know, Rebel, if you want to add something about the representativeness of the data set. I mean, you spent a lot of time looking at the maps since you built most of them.
And keep me honest here, Sam. A lot of the data gets ingested from what different countries' Ministry of Health decide to make public, right?
Sure.
So they could be daily pressers of how many cases were discovered, or they could be monthly aggregates. Whatever is made available publicly is what gets ingested. And because everybody sort of has a different way of presenting data, whether it's a clean CSV or a PDF of a manually typed out piece of paper, you sort of have to accommodate for all these nuances when ingesting the data. On the bright side, if you guys take a look at the map visualization, the coverage is decent. It could definitely get better representation in certain pockets of the world. I think there are outliers like like Estonia, Sam, like we were talking about it the other day, where the coverage is practically 100% or a little bit more.
It's 110%. We don't know what's going on.
That's 110%. Yeah.
I mean, I appreciate the effort, but it doesn't add up.
Well, what's interesting, right, is we capture data from formal and informal sources as well. So
exactly.
We sometimes have more cases than the countries themselves report.
Mm-hmm.
And we actually have the only publicly available data on China's early cases, because we had volunteers who were hand entering it as they were getting reported in social media accounts back in January of last year. And so even for the United States, if the US released all of their records, let's pretend they had all of the records recorded, we would have more cases because we started entering manually the cases that were reported via social media, via press releases back, earlier than this time last year. And that means, in particular, we have some of the really early data. Ghana, for example, was releasing every case via press release. They're still up on the ministry's Facebook page, I think, but you can go through like press release by press release and see the cases, the age, the demographics, what city they were in, all that kind of stuff, is whether they traveled to China or not. All that's there. Fortunately, we were capturing as it happened, so we don't have to go back and retrospectively do it because the job would be too big. But that's one of the things we want to make sure we're ready for in the future is you're going to have to do manual data entry early on because there won't be a data system in place by definition.
You guys will appreciate, I asked Brian to literally put our guests' book recommendations into an Excel spreadsheet, and he was like, I'm not sitting at the computer that long. I'm not doing it. Meanwhile, Rebel,
it's maddening. How do you do it, Rebel? My God.
Oh, man. So I want to, you talked, there's obviously a disconnect in some places. Like you said, you started hand tallying some data, and then there's official records or semi-official records, and sometimes it's 110%, sometimes it's far less. You've got places like Brazil that are just having an impossible time. You've got places in Africa where people are going like, how could they be faring so well when obviously the number of factors are so complicated. You've got Southeast Asia, which was prepared in so many ways because they dealt with SARS and we didn't. All of these different things. But we've also got, again, like this public that has educated themselves as much as they can, frankly, in a lot of places. And everybody becomes a prognosticator, right? And then there's also people that are just, whether they're a policymaker, an elected official, or a TV host of some sort, or radio, they are invested for one reason or another in this thing going a certain way. And so we get into the misinformation realm, which seems to be, it's been around for forever. Everyone thinks it just started. It's not. But at this point, it does seem like an indelible part of our society, right? It's just moving faster and it's moving deeper, and it's very dangerous. And we can know that, and we can track that now. We can see what happens with, encrypted WhatsApp groups in these war-torn countries. So it predated this pandemic, but 500,000 deaths doesn't help, right? Folks have both on one hand lost trust in specific leaders, but also institutions. Look, I'm not a scientist or a doctor or journalist. I'm a very candid about this, but I went to a liberal arts school, man. We asked questions. I'm like a pagan atheist, but we studied religion and anthropology and sociology. And forever, people in extreme times have searched out content and people and groups that they can connect with, right? And that's part of the reason people look to prepper groups or religion or things like that, or Newsmax, for leadership, for community, to try to find a reason, however plausible, for why things are the way they are, and sometimes to be told what to do and how to act. Last night, when I was sitting here thinking about our work and thinking about how to have the conversation today, I noticed Alexis Madrigal at The Atlantic was literally tweeting the new CDC director because the CDC took over. They shut down the COVID tracking project that they worked so hard on for a year. And Missouri showed this, and the new CDC database, Missouri, showed this big spike in cases. And Alexis was like, you can't just put that out there. People are going to freak out. You have to have some sort of notation, or people are going to get scared and they're going to read into it. Believe me, like, I answered 40,000 emails about this over the past year, like all in in good faith, but society is so fragile right now. And people are still scared and they're still overreacting, even though we're, getting towards the end of this, hopefully. How do projects, like you said, that have so many folks involved, so many good folks, but don't represent everyone yet, and don't represent all cases yet, but how do organizations like this and the people behind it, how do you solve from the beginning for ethics and trust? From top to bottom? How do you build that, not only these data sets? How do you become trustworthy so that we can move forward?
I think it kind of goes back to the first jaw-dropping question, right? Why are you vital? Or are you vital at all? And I think when it comes to ethics and trust, it's, you can assemble an Avengers, the Avengers of all super team, super bands, and you have a lot of talented people. But at the end of the day, I have to be able to, the person immediately next to you has to be able to trust and vouch for you, I guess.
Well, I mean, what that reminds me of is one way that I can decide if I trust something is based on my relationships with the people that I have involved in the project, right? And so if I trust Robel, then I'm going to go into anything he's involved with more trust to start out. And how do you do that in an international distributed community when we're all online? How do you do that in such a way that it's not going to be co-opted, or at least if it is, there's something you can do about it by individuals with, nefarious motives? And I think what we tried to do at Global.Health is to engage with this at the very beginning. And so work with ethicists, data privacy experts, lawyers around how do you build a consortium? How do you construct the legal entities around the data? How do you engineer the back end and front end systems of our software to have privacy and ethics part of the design process and one of the objectives that we're working towards? And it can be relatively simple things like linking back to all the sources of the data. So in principle, someone could run their own audit against our database. It's also being open and transparent about where the data are coming from and why and what we think they represent. But it's also, especially in the US, a really tricky issue to think through. In South Korea, for example, they have a social contract between the government and the citizens that if there's a public health emergency, the telecommunications companies release all of the data on individual movements over to the Korean CDC as a part of contact tracing efforts. And that's part of the reason they were so successful in their MERS response a few years ago, in their COVID response now. And instead, in the US, the tech companies have all of the data, but we don't get to benefit from it on the social side during a pandemic. And so even trying to navigate what we mean by the ethics is difficult, because then that's the US experience. And now we think about, okay, well, let's talk about Sub-Saharan Africa, even though we're going to be lumping together a huge number of diverse countries. Country like Kenya has a law now similar to the GDPR in Europe. And a part of that law is that information that contains data on Kenyan citizens needs to be stored on Kenyan soil. And the GDPR has the same law for Europe. And so why is it that if Europe says you got to store European data on European soil, that Kenya can't say you got to store Kenyan data on Kenyan soil?
Sure.
Well, here's one reason you can't do it. The cloud data providers, at least as of last year, didn't have any data centers in Sub-Saharan Africa. So all of those countries are completely cut out from being able to have those kinds of laws. So if we think as an international community that that's the ethically responsible thing to do, I'm not saying that it is, then whole swaths of the planet are cut out of that. And so that's part of what we're trying to do at Global.Health, is have this broader conversation around what do we need on the technology side? What do we need on the legal and ethical side to really embrace this challenge, understanding that there will be cross-cutting themes, but every country is going to have its own issues that we're going to have to engage with if we're really serious about it.
Sure. And that also comes back to like these sociological and anthropological and political science questions, which is like, and I always am trying to, whether it's talking about urban heat or medical outcomes or sea level rise, like dialing this thing back down to the first principles, like the immovable fundamental pieces of these things. Like you said, each country is going to have its own issues. Like you said, they want to store it on Kenyan soil. That's great. That now becomes a hardware problem because, like you said, those things don't exist there, where we've been offshoring stuff to Ireland for years. They've got plenty of data centers over there, right? So that becomes that. But then you have to ask yourself, like, okay, so why aren't those things there? What have we failed to do or failed to support them in some way? And why haven't those companies done those things, et cetera, et cetera? It's complicated, and I don't envy it, but we need to have those discussions because, you know, if people are acting in their people's best interests and their country's best interests, and global health's best interest, because if there's anything we've discovered from this thing is that it travels, we can't just say, well, hey, here's the right thing to do and you guys need to do this, because nobody's got the right answer these days for any of these things. We have to be a little more open about them and a little more transparent about them if we're gonna, like we said, have a face down something that presents itself even more differently than SARS did and MERS did and COVID did.
No, I completely agree. And, you know, I think that word transparency is really important. It's one of the things that I try to do when I'm speaking with journalists about COVID-19 is be as open and honest as possible about where I think my biases are. I know I have plenty of biases that I don't know very much about, or I'm only learning about. But at least being transparent about the things that I do know so that it will help people interpret what I'm saying in the right context. Is so important. But maybe perhaps one of the bigger issues, and would certainly be interested in all of your takes on this, is that, you know, in the US, there's this rhetoric around science as some objective truth. And there may be some objective truths out there, some of the laws of physics, you know, those kinds of things. But by and large, science is just as much a human endeavor and a human problem, as Robel alluded to in his opening, right? That you cannot separate epidemiology from the politics. It cannot be done. If nothing else, because the politicians are the ones that decide what happens and what doesn't happen. But then as we see, even if you open up the restaurants, if people are shit scared, they're going to stay home. And so you got to open up the restaurants after you've controlled COVID, because then people will go back to the restaurants if they feel safe. And that's the challenge, right? Is that part of what we're trying to do when we educate people is navigate, I think, this misconception about science as a source of objective truth. I think it's a way of reasoning about problems, and it is a way of approaching complex systems in a rigorous, ideally reproducible way. But it is not necessarily going to find an objective truth. And as you kind of alluded to in the beginning, Quinn, even if we find the right answer today about COVID, that may not be relevant to the COVID of tomorrow. And some things will be. We need to learn the lessons and remember them, but not in a dogmatic way that prevents us from responding kind of adaptively as new challenges emerge.
I mean, MC Hammer put it best. Was it last week, 2 weeks ago, right? If you're going to measure, you have to include the measurer. And it's like, oh my God, that should be plastered on like every building. It is everything that is, it's interesting, right? Because it's 100% true. We always talk about
110% even.
110%, sure. I mean, we talk about, again, let's get into the history side. You know, history is written by the victors, right? So we talk about, the financial bull markets of the 90s and the economy was some of the best ever. Sure, for a segment of people, but for another segment of people, the war on crime and the war on Black Americans and the war on marijuana destroyed entire populaces, and we built 1 million private prisons. Like you have to tell the whole story, and if you're not coming back to if you're going to measure, you have to include the measurer, which is usually people that look like Brian and me and Sam, and not usually people that look like Rebel. We haven't let them do the measuring, and so. Suddenly we have a pandemic and the seas are rising. Like the receipts are in, it didn't go so well. But at the same time, like we have to be more transparent about that. But what's also interesting is I'm thinking of, you guys might be familiar with this newer group that's out there called Data for Progress. They do, I think they describe themselves as a think it's like a multidisciplinary group of polling or political experts using data science to support progressive policies and people behind them, right? So they mostly work on analysis and polling and policy and messaging. They don't, as far as I can tell or anyone tell, and again, like Sam, you were saying, it's about trusting the people involved, and I don't know them that well. I've tried to, but they're not just cherry picking polling data to support liberal candidates, right? They're trying to support measures that will progress society and outcomes, right? To build this cleaner, more just world for many more people than just white men, landowners. And so I'm curious about how we take, if we can, should we can, take projects like this, which isn't operating specifically in the political sense, and look at American outcomes. Our medical system is entirely reactive, right? The supply chain was just in time. We don't have a sense or prerogative of wellness, right? We just published a conversation this week, which was incredible, talking about how and why, both things equally important, young Black men die after heart transplants way more than every other group. And the factors are so many. And so the inputs are overwhelming, and the entire system is killing large swaths of people. But I want to have an impact. I want to move people here. I want to bend the fucking arc. And I want to know, should we use data like this, things like this, whether it's about energy, it's about epidemiology, to create more actionable progressivism? Does that sort of thing exist, or does that break the laws of what you guys are building? Because we have problems that need addressing, and I'm curious if tools like that should be used for things like that, for policy making, for polling, for messaging.
In a perfect world, yes, they can. But it goes back to what the Honorable MC Hammer said: when you measure, you have to account for the measure as well, right? Because it's sort of it's the problem with facial recognition AI not being able to recognize or discern the differences between different Black and brown faces, which one used by, ICE or Homeland or law enforcement becomes a devastating, horrifying, appalling fuck up. It's healthcare data that for the same reason where, Black men die of heart attacks at a much higher, or heart attacks at a much higher rate. And you're looking at Black women dying at childbirth at a much higher rate. I think there is something to be said about getting representation, not just in the lineless data of the data that you're getting, but also in who gets to analyze or parse that data, having enough diversity in who gets to present that analyzed or parsed or visualized data, and also who gets to, and also like having the diversity in the policymakers who get to take that data and do something with it. So I think the biggest mistake is in thinking that getting diverse data is enough, because that doesn't do much if every layer of process after that doesn't involve as much rigor in that diversity and inclusion and nuance as the lineless data does. Which is why, again, in an ideal world, you would have ethics departments and regulatory bodies who are more vested in not doing racist, sexist, transphobic, homophobic shit than actually being called racist or sexist or transphobic or homophobic. I think when people talk about representation as to account for all these, for lack of a better word, failures in different segments of society, I think they just come at it as a very, here's a freebie that's going to fix this quickly type of approach, when it really doesn't. What do you think, Sam?
No.
I could go on about this for forever.
You're welcome to. We have no time limit here.
One of the ways that governments disempower populations of people is by excluding them from data sets. Part of the reason we fight so hard over how the census. And so one way that communities can be empowered is by ensuring that they are included in the data sets. But as Rebel pointed out, one of the ways that governments marginalize, control, abuse populations of people is through data on them, through surveillance and monitoring. And so there's this push and pull between how data can empower and how data can disempower. And what that means is that you need to both ensure that data are representative and they're collected on populations of people in such a way that those populations are empowered, that their needs and wants and dreams are visible to the government, but that there are representatives in the government, that there are representatives who are responsible for analyzing those data, for communicating them, for designing policy that come from those communities that understand the needs and wants and dreams of those communities. And it's that whole picture that you have to have complete if you're really going to be successful. I think an anecdote about this is all of the news coverage around vaccine hesitancy in communities of color. And we hear about Tuskegee, and everybody says, well, it's a well-earned distrust. And it's like, well, that's true. But also there are no fucking vaccination sites in communities of color. The first vaccination site that opened up in Boston was in South Boston. South Boston's a great place. It was not one of the hardest hit neighborhoods. It's majority white. The hardest hit neighborhoods throughout Boston, the majority minority neighborhoods, only February 27th, I think, did they mass vaccination site open up in one of those neighborhoods. So right now, it's not about vaccine hesitancy. It's not about Tuskegee or the 10,000 other things that we've alluded to since Tuskegee that have happened. It's the fact that we didn't engage with individuals in the community. We didn't reach out to them. We did not include them in the process, and we did not take vaccines into their neighborhood. And so it's both sides of that. Yes, we need to have the data to understand that Black women die during childbirth at substantially higher rates, that you have big issues associated with heart transplants, as you pointed out, in Black men, that we understand the racial injustice that has happened in the medical and healthcare system, so that we know how big the problem is and how important engagement is in terms of beginning to move forward from that. However, in Massachusetts, we're talking about equity. We're not even vaccinating equally with respect to population size per capita. And so that means that Robel's point, that's the one we got to be working on, right? Is ensuring that people that represent those communities are making the policies, are running the analytics, are building the visualizations. That's where the delta is right now. Sure, we need better data. We always need better data, but that's I think a red herring.
Well, and that's kind of what I want to get at there. Like, if someone came to you, let's say a young Black politician or someone running for office, or an indigenous person, whatever gender, and they came to you and said, Global.Health is amazing. I need this data. I need you to run X data, or I would like to use this data in this talking point or this speech or this policy or this messaging, whatever it is. Are you comfortable with that? Is that how you, are you comfortable with that being used this way? Or, I'm curious about, like, how do we move that line? Because clearly, like you said, we haven't learned anything. We haven't made any changes in 400 years, much less 100 years, much since COVID started. We knew COVID was over-indexing on both exposure because of where they are forced to live and work for Black and Brown and Asian and Indigenous Americans, and then they were hospitalized and killed at greater rates. And yet, 3 months later, we break out the vaccines, and they are under-indexed on receiving them because we, like you said, we didn't roll out anything mobile, we didn't open sites, we didn't engage with communities. We continue to not be actionable on the things that we know. We've already had a lot of this data, man. We've had it for a long time, and it's because the system was designed to work this way. It's not broken, right?
It's worse than that.
Oh, good.
Nathaniel Hawthorne, who wrote The Scarlet Letter, he wrote a short story about early days in Massachusetts and smallpox outbreak. And a smallpox outbreak starts with a rich person moving smallpox into the community and spreading it around, and ends with a wholesale death and destruction in the poorest parts of the city. this is nothing new when it comes to effects of racism, when it comes to the effects of classism. And we saw that with COVID. You can see in our line list data, it is overwhelmingly 40 to 60-year-old males who show up with COVID in all of these countries. And it is overwhelmingly minority communities, whether that's Black and brown communities in the United States or whether that's indigenous communities, or, the list is long in every country, which groups are marginalized that die after COVID takes hold.
Yeah. And this is what I want to know is, how do we make this stuff operable? How do we partner with groups like Run for Something, right? Which exclusively works with Americans under 40, people of every gender identification, with mostly women. How do we pair these type of groups and institutions together so that we can, for lack of a better word, probably poorly chosen, arm those candidates, those people, with the information to go out and do that, because they are mostly, again, a group like Run for Something mostly works with local and statewide folks. They're running people for fucking school boards. They're running people for city councils and things like that. That's where you have an impact with data like this. It's not just like, oh, look at the global outbreaks and this and that. This is what happened to our community. This is what's happened over time. This is how we can use it. And this is how we can build that into messaging and policy. And yeah, that seems to be it's easy to say it's a disconnect. I think that's lazy and probably what I've said most often, but it's not a disconnect. It's an intended consequence, is not enabling those people to be able to do those things.
I want to kick it over to Rebel, because my vision for how you do that, it involves technology. You can make the data interoperable and easy to access so that those groups, they just take it, they use it, they're empowered by it. They can analyze it, as we said. They can help close that loop. I don't know, Rebel, if that's your...
And that would essentially be my take as well. With Global.Health, the data set is quote unquote open source. You can download the entire anonymized data set if you choose to do so. For whatever reason, you might need 10 plus million line list data. And if this amount of data is meaningful to craft policy around, that's an absolutely great thing. But it sort of goes back to asking who is making the policy and for whom, who's doing the measuring, and what are they measuring and for whom are they measuring? Because as diverse as this line list data is, what ends up coming out of it could be something completely different. But this is a necessary first step. And like Sam said, it's making this interoperable, making the analysis side of it as user-friendly as possible, as open to integrations to different platforms as possible is fantastic. Because I've been doing this for a few years and I still find some types of data visualization just overwhelming and not particularly useful. I can only imagine a policy wonk that's not really interested in charts or visualizations trying to parse through something like this. So there's definitely a data diversity side of it, which I think Global.Health is continuing to deliver on. But the next natural step is definitely, okay, let's make it easy for everybody to be able to read, parse, and analyze this data.
Yeah. That's I wanted to ask you, Rebel, because it's super important for our community to understand that, everyone's capable of contributing to huge issues like COVID and climate change. Every person has, something that's applicable. You've been working on data, like you just said, data engineering for a long time now. Do you feel that a skill set like yours is more useful and more applicable than before?
Possibly. And to be perfectly transparent. I don't find what I do to be particularly extraordinary. I'm a drop in the ocean of like terribly talented people that I'm only trying to emulate, really. But there definitely is a use for this kind of talent, especially at this point. I think society slowly and hopefully trying to move towards a more evidentiary or data-based decision making or data-driven decision, I think is the woefully catchy, trending phrase. It's a useful contribution. It's a meaningful contribution. But again, it's absolutely meaningless if there is really nothing to follow up on that in terms of larger decisions around what helps us all as human beings make the next step better.
Yeah.
Although one thing I would add to that is part of trust is websites looking, feeling professional, functioning under high volume, like all of the engineering stuff that requires.
Are you ripping on my website right now? I'm trying, man.
No,
I was just thinking that.
I know it's broken,
Damn it,
dude.
Sam.
I'm working on it, man.
But I'll tell you what happened is that a couple of days ago, a major Twitter personality tweeted about this mobility dashboard that Robel worked on with us back at the beginning of the outbreak. And it spiked the usage, 200x in a few seconds as soon as he tweeted. The website didn't crash. It just ran along like it like a professional built the website, not like some academic sitting in a basement somewhere that happened to take a coding class a few years ago. And so part of it is having real professionals who know how to build these things. That also helps with the trust side, right? And I mean, it's a big part of the reason why we're so fortunate to have people like Robel who are interested in contributing to these sorts of projects, because it lends a measure of credibility that we would never be able to build off of our academic CVs, because the website would fall apart as soon as anybody looked at it.
Yeah. You're so modest, Robel. You're a badass. Own it. You guys, if it was March 2021, like it is now, and you were grad students or college students or community college students, or maybe you didn't want to do anything with, I didn't go to college, but you wanted to join the fight for public health, where would you start?
Yeah, knowing what we know now, would you pursue the same path? Would you guys do the same thing, build the same things?
What do I do? Basically, I'm asking you, what do I do?
No, Brian, this is not a question for you. This is for this is for other folks. Please leave yourself out of it. That's a different podcast.
Well, if I were you guys, I would start a podcast and I would bring people on who can tell us what it is. I mean, that's what I would do. But,
nailing it.
If I could go back and do anything, I'd be a podcast.
It's terrible. It's so bad. Don't do it.
You're really getting the good digs in, Sam.
Well, the website one was totally unintentional. For me, public health agencies are so massively understaffed and underfunded, under-resourced. Community health organizations, individuals working with vulnerable populations, whether that's homeless, displaced, individuals who are experiencing effects of racism, transphobia, all of these huge issues. Any way you can get involved at chipping away at those problems. And whether that's just showing up and volunteering, whether that's donating money, whether that's running for local political office so that you can get more money flowing into the coffers of these organizations, whether that's going back to school and getting a master's in statistics and getting a job as an epidemiologist working for the county public health agency, and working your way up through the health agency. There's so many ways to contribute because the need is so massive. I think maybe the one take-home message would be we need everybody to be contributing, and everybody has a way to contribute. Just ask for what's needed. And almost certainly on this giant shopping list of things that we need to work on, you're going to find something that either you can do or you want to learn how to do. And, and if you want to learn how to do it, then assuming you have the privilege, take advantage of it.
That's the much more eloquent version of what I've discovered is the easiest way to, again, we've got 40 different systemic issues, right? Many of which of our own design that we're trying to get out of. But, whether you're riding in the back of an Uber or whatever, it's friends and family, they say, what can I do? And the best answer is usually what can you do? Because whether it's design or data engineering or another version of data science, or it's podcasting or it's art or it's writing or running for office on whatever level, everybody can contribute something. But what you guys do now, I mean, you guys are until the next pandemic, I mean, you guys are rock stars of a certain segment, right? And so that's what, I appreciate you taking the time to really think about that, especially Sam, because I know you work with students every day and these young, energetic people. Again, it must be nice to have energy, who are coming up and thinking like, okay, this is where I can fit in. This is where I can make a difference. Rebel, what about you? I guess, do you regret the time you've worked with Sam, or do you feel like you would start like we can take it offline if you need.
No, obviously I don't regret any of it. I think if anything, I wish there was more I could do. Everybody has a craft. Everybody has a skill, no matter how they choose to aggrandize or minimize it. They have a skill, and I think the difficult moments happen in how you choose to use those skills. And again, what can you do, right? If you're a writer, you could write about something that could move the needle on this particular thing. If you do podcasts, you could do that. If you build websites and app and make things pretty and functional, you could, dive into projects that could hopefully make a meaningful difference in public health and how that whole environment uses and analyzes data. I think that is probably fundamentally the easiest step that could also have some personal rewards. I mean, I'd love to sign up for grad school and do complex sciences and network science and get a PhD attached to my name and take over Sam's class and put him out of a job. But
that would be awesome. Anytime.
Welcome.
We'd be thrilled to have you.
No, but again, it's what you choose to do with the craft that you have. If you're an undergrad, grad student, and you haven't even figured anything out, but you still want to make a difference, I am pretty sure every collegiate town has at least one volunteer organization or nonprofit that's working with communities to make a difference in the middle of this pandemic, whether it's volunteering to hand out and give out face masks or do after school programs or teach, whatever. There definitely are hundreds of avenues to make a difference. I think committing to it and taking that first step is probably what holds people back, because they might feel like nothing is going to be good enough.
That good old fraud symbol.
Paraphrasing Kurt Vonnegut, and there's only one rule, right? And you can't be a fucking asshole. Otherwise there's something for you to do. And we need you.
Yep.
That's what's on my wall.
No.
I don't know if you can see it. Work hard and be nice.
Work hard.
Are we going to name this episode "Don't Be an Asshole"?
Maybe.
It's been a recurring sentence. I love it. Those were good answers. Those answers make me feel like I should probably do something more with my life. All right, Quinn, you want to get into it here?
Yeah, let's bring this home.
Let's get to our action steps. One of the most important reasons we do this whole thing. Always, what we want to do is be able to provide our listeners with something that they can do to support your mission. We like to talk about them doing that with their voice and their dollar. So let's start with their voice. What are big, actionable, specific questions that all of us should be asking of our representatives to support your mission?
Well, I think right now it's what specific steps are you taking? And you here is relevant political representatives. What specific steps are you taking to close not the massive equity gap, but just the equality gap in terms of vaccination coverage and access in the United States?
It's pretty specific.
And then the second one would be what specific steps are you taking? And this is probably directed towards your federal representative to close the even larger gap internationally in terms of access.
Rock on.
Awesome. Love that.
Rebel, any additions to that?
I think that pretty much nails it, really. Specific to that.
I guess I'll add one just because are you being an asshole would be a great question to ask.
Is anybody going to say yes?
And what about their dollar? Where can our listeners throw some money to help you guys, to help everyone?
Well, on my side, food insecurity, housing insecurity are huge problems. Opioid-related crises across the U.S. Have exploded during COVID-19 for all of the reasons that you might imagine. So any organizations that are working with those groups, I think for me, one of the more profound volunteer initiatives that I've been a part of is helping distribute diapers and feminine hygiene products to individuals that need it, because that's typically something overlooked when people are donating. And it's often one of the biggest needs after any kind of natural disaster or emergency or just day-to-day life. And so if that's not something that you've been donating to, start.
Yeah, we actually, just to interject real quick, we built a page. I think it's important.com/diapers. Is that right, Brian?
Yep.
We'll put in the show notes, and it's got links for all the diaper banks in the U.S. that need them right now, because they're basically all out of fucking diapers. Everyone should empathize with that, but if you've had a child or been around a child at all, I mean, it's one of those necessities. I mean, it's like food and air and water and shelter. Like, it is impossible to parent a healthy child without those things, and it's an absolute disgrace that is something that's completely unavailable to so many people. So yeah, you can do that there. All right, why don't we bring this thing home here, guys? Thank you so much for all of your time and thoughtfulness that you've put into this, and obviously all the incredible work this year and with Global.Health. Last few quick questions here we ask everybody, and you can take turns, whatever you would like.
Gentlemen, at the same time.
Yeah, that's always great. When was the first time in your life when you realized you had the power of change or the power to do something meaningful?
Instead of talking over each other, we're just going to stare silently at the computer.
I'm into it.
I'm trying to.
I was just thinking, Sam, we must have already asked you.
Right. Sam,
the first time, right?
If you hadn't said that, I probably was ready to answer. But now, because I'm sure I'm going to say something different,
that's okay.
I'm just going to let Rebel go.
I don't think it was any specific. This is gonna sound corny, because this is really the only thing I can think of. Because I can't put my finger on a specific incident where I thought specifically that. But like you, Quinn, I'm a pagan atheist, and I remember going through the motions of reading and discovery and curiosity and logic and reason, and getting to the point of, oh wow, okay, I have come out of this a different person. And I'd like to think a better person. But that's objective. But I think the fact that I was able to go through that change or that transformation and that growth, I think is probably the first indicator for me that and hopefully I would be able to do, not specifically that particular thing of going from a religious upbringing to abandoning it, but any meaningful change that could hopefully help growth or transformation in somebody else. Again, corny as hell, and I'm sorry, but that's really the only thing that I can think of. Well, it's not changing anything or anybody else, but the fact that I went through that is probably more meaningful to me in terms of understanding what I could do to change situations or other people.
And you think that it hasn't affected anybody else, that got you to where you are today, and you just, among your many accomplishments, you built a massive database of 25 million records about a pandemic that's going to save lives.
With
of course,
with a team of unbelievably talented people.
Absolutely, man. But it got you here, and so we're thankful for that. Sam?
Same answer. But it's I guess I was going to say when I came on the podcast 2 years ago, right?
You don't.
No.
Enough.
Sorry. The thing that came to my mind, I'm going to go back and listen to what I said last time, is the first time I stood up in front of a classroom of students. I was an undergraduate in Indiana, working as an undergrad TA for a biology class. And you're standing there and you're realizing that all of these people are listening to me. And then somebody tells you afterwards that there are people in that room that are going to be looking up to you, whether you want that or not. And it's a responsibility that if you're going to keep doing this, you have to take seriously. And I think for me, that's been, one of the most incredible parts of the last 15 or 20 years of my life is getting to play some very small role in helping educate and mentor individuals as they go through the process of college and of now of graduate school and getting a PhD, and then now of transitioning into role as a independent scientist and researcher.
Awesome. You hold great power, my friend.
Yes.
Gentlemen, a little shorter. Who is someone in your life that has positively impacted your work in the past 6 months?
My wife.
Well, I'm also going to say.
Are you going to say Robel's wife?
I also haven't.
No. Well, but by Robel being here, then that certainly is a positive impact. I'll have 2 answers then, because certainly my wife is also an answer, in part because she's an English professor and has a master's in rhetoric and writing. And so if I've ever put anything out in public that was legible and accurately communicated what I'm trying to do, it's because she's helped me with it, or
because the original draft is covered in red ink.
Yeah. The other, his individual has been on the show, and every 6 months, if you ask me for the rest of my life, it's going to be Professor Brandon Ogbunu, who's at Yale. Constant source of inspiration, both in life and in science. Every conversation with him is inspiring.
Yeah, and I can't thank you enough for that original introduction. He has become just a massive influence on me. I could not have more respect for that man, and the way he is not only doing the work he's doing, but the other ways he's putting himself out there is pretty awesome. Pretty awesome.
It's amazing.
I agree. I just stalk the man and his brain.
It's incredible.
Twitter.
I love that he's writing for Wired. I mean, doing all this stuff. It's awesome. All right, Brian. Let's do
Robel, do you want to expand at all on your answer to that question, by the way? Or we just sort of moved past it, but
not just the past 6 months. The past year has been super different in terms of working full time and parenting full time. We have a 2-year-old toddler. Both my wife and I work. So to have to have that partner that is, I mean, saying supportive is corny, but it is true. To have that partner that's supportive, but also she is a sounding board that definitely makes my work and thinking significantly better and more refined.
Amen.
Yeah, and amen indeed. And I'm grateful for that.
I love it.
Incredible. Awesome. You guys, what's your self-care? What do you guys do for yourselves
when you're not totaling up the apocalypse?
Yeah.
Try to make time for books.
That goes into our next question. What's a book you've read this year that's changed your thinking in some way?
This is going to be a humble brag moment. So I'm on my 11th book for the year so far. Trying to get to a book a week. And I came short last year and came up even shorter the year before. So I'm trying to just cut back on Netflix and Amazon Prime and all of that, and then just go analog on, books on paper.
That's great.
So the first book I've read that sort of like blew my mind is called, it's by a Vietnamese American author, Ocean Vuong, called On Earth We Are Briefly Gorgeous. It's a work of fiction, but brilliant piece of work about the Vietnam War, Vietnamese immigrants in the U.S., and then the author's pseudo-biographical coming out story as well. But it's told in these 3 parts that address those 3 different issues in such a incredibly poetic and vulnerable and mind-blowing kind of way that I went down a rabbit hole just chasing all the cultural references from that book, like looking up traditional Vietnamese like mourning songs to deal with grief and loss. Even though I don't speak a lick of Vietnamese, but it was definitely an eye opener and extremely rewarding literary wise. So I was happy about that. And he's not cutting me a check to say this. I don't know the man.
Sure. Sam, what's your self-care, man?
Well, I mean, I haven't been on an airplane in just a little bit over 12 months, which for me it's the longest in my life by far. I mean, I flew. I'm not even going to talk about how much I flew before because you'll throw me off the show climate change wise. But as a result, just exercising, working out, I've probably lost 35 pounds in the last year, which I needed to lose.
Wow.
So that's been super important. But the more fun answer is that we got a Nintendo Switch, which is the first gaming system I've owned since high school. And turns out that both my wife and I love Mario Kart. And so we take these random like 15-minute breaks in the middle of the day and just do a couple of circuits on Mario Kart. And we're spending a lot more time together during the day now because we both work all the time. And so that's been kind of
that's amazing.
Is such a great answer.
Who's your go-to driver, man? Let's get into this for a sec.
I switch it around. But it's got to be a shelled driver, and it can't be Bowser because Bowser's too big. It blocks my kind of vision. Although I will say that it was like about 2 weeks ago when I actually realized that the controller turns. And so part of the reason I was having trouble is, I mean, I drive like this from the old Nintendo days, but you can't see what I'm doing in my hand. So I'm sure you can imagine what I'm doing.
We can. It's on video. It's amazing.
Yeah, I see it.
I mean, I know you can see, but hopefully whoever watches listens
No,
to this
they
later
know because they've known how to drive in Mario Kart for 25 years. They're just like, why has he just figured out how to steer?
Well, but I'm sitting there, I'm like, why am I keep going off the course? And it's like, because the controller is slightly more advanced than what I had in 1997, and it actually turns when you turn
a little bit.
Sure. That's amazing. Mario Kart Breaks is fantastic. That's awesome. You got a book you want to talk about briefly?
Yeah, super briefly. I mean, I was thinking there's a bunch of great books I've read over the past year. It's definitely one of the things that I do for self-care as well, although not as much as Rebel and not as much as I'd like to. But Pachinko by Min-Jin Lee, fantastic book, 4-generation story of a Korean family. It's beautiful story and history and incredibly well researched. I heard her speak at Northeastern not too long before the pandemic, although time kind of blurs together. So definitely, if you haven't read that, it's really just a fantastic novel.
It's an incredible journey. Gentlemen, this has been pretty fantastic. I really appreciate your time on top of everything else you guys are doing. Where can our listeners follow you online?
Well, Global.Health, not Global.Health.org or Global.Health.com, although I think those redirect, but just Global and then a period and then health.
Perfect.
That's where all this information is. I'm on Twitter, SV Scarpino. I'm also all over the place. There is one other Sam Scarpino. He, I think, had a band a few years ago that's not made it, and so I'm pretty easy to find because there's no other prominent. Although there is another prominent Scarpino that he does a bunch of YouTube stuff, I think.
Brian can make those guys go away. It's fine.
If that band, awesome. We'll get the right Scarpino and Rebel.
Yeah, as Raw Bubble at Raw Bubble on all the things. On all the things. Trying to stay consistent.
Brian got a whole lecture about that last year.
Yeah, I was just going to say, yes, I did. Thank you, Quinn.
Oh, you did?
This has been awesome. Gentlemen, thank you so much for your time and all the work you're doing. It's truly an incredible resource for humanity, which is not something one can say lightly. So we appreciate it. Thank you for guiding us through all this stuff.
Yeah, thanks for coming back again, Dr. Sam Scarpino. Awesome to have you.
Absolutely. Such a thrill. Thank you both for everything you've done over all these years now. Both in terms of the types of people you bring on, the kind of platform you give them, but I think just your commitment also to action steps is something that we need a lot more of because that helps, right? I mean, as we talked about before, just doing something matters. And to the extent that you can help inspire people to do things by giving them specific suggestions, that's just an incredible resource that you've put out into the world. So thrilled to be here again. And thanks so much for everything you guys have been doing.
Absolutely. Thanks to our incredible guest today, and thanks to all of you for tuning in. We hope this episode has made your commute or awesome workout or dishwashing or fucking dog walking late at night that much more pleasant. As a reminder, please subscribe to our free email newsletter at importantnotimportant.com. It is all the news most vital to our survival as a species.
And you can follow us all over the internet. You can find us on Twitter at importantnotimp.
Just
so weird. Also on Facebook and Instagram at Important Not Important. Pinterest and Tumblr, the same thing. So check us out, follow us, share us, like us. You know the deal. And please subscribe to our show wherever you listen to things like this. And if you're really fucking awesome, rate us on Apple Podcasts. Keep the lights on. Thanks.
please.
And you can find the show notes from today right in your little podcast player and at our website, importantnotimportant.com.
Thanks to the very awesome Tim Blaine for our jammin' music, to all of you for listening, and finally, most importantly, to our moms for making us. Have a great day.
Thanks, guys.